John, but we do need to get started.
Yeah, oh, that's okay. That's okay.
And I am going to record, just so people know.
Because we don't.
Should we turn the
we're
lights
not
on,
a-
maybe?
We don't have a restaurant,
easier
a
for the-
limited
Right.
restaurant license. So we
All
can
right.
only pay 12 meals a year.
So I do have to tell everyone on the
For free.
screen,
We
this
can't
has a
process
bit,
food for
oh,
free. We can
Melinda,
process
so
food, give
right,
away, but we can't for free.
here, hold on a minute.
I guess we hit the bell too soon. Keep talking.
Yeah, oh, there we go.
There we go. All right.
All right.
All right. Easter sunrise service here.
Okay, as I was saying, first of all, welcome everyone. I must tell you, today's meeting has a bit of a COVID feel to it, in that is the smallest in-person gathering we've had since we came back in a hybrid model, which is what, a year and a half ago, I guess.
Yeah.
Which is fine. I mean, it's people being able to join, and that's the beauty that we learned throughout that experience of how a video conferencing platform can keep people immersed in a meeting, even though they may not be able to be there in person. So anyway, want to welcome everybody to the April meeting of the Franklin Grand-Isle Community Partnership. As always, thanks for taking time out of your busy schedules to come to this meeting. We greatly appreciate it. And of course, this, everywhere you look, Monday, the eclipse, can't miss it. So maybe we'll have some fun with that today as well. So now let us move on to minute approval of the March 6th meeting, which I know was in everybody's packet that was emailed, as well as it's in front of folks here. Could I get a motion to accept the minutes?
Yeah, John Gordon, motion.
Okay, is there a second?
Second.
Okay, Nicole, second. Any further discussion? Okay, all in favor, say aye.
Aye.
Anyone opposed? Okay. So that takes care of our meeting minutes. Now, this month's presentation comes to us from Pathways, and titled the Pathways Vermont Overview. And Molly Shriver-Blake and Olivia Norville will be presenting, and they will be presenting, as you have learned, via Zoom. And I don't know whether or not you have a slide presentation incorporated as well. If you do, certainly you can control that. You've given them share screen?
I have.
Okay. Okay, so the screen is yours.
All right. Oh, Zoom is different. Can I do just...
So you should have a menu bar at the bottom when you move your cursor, and it'll say share screen. And then if
I
you,
just want to just do one tab, not the whole window, or I'm just going to pull the tab out of the window so that you can't see pop-ups. You don't want to see the pop-ups.
oh, let me change the speaker view.
Yes.
Okay. Yeah.
All right. Does this look right to folks?
Yeah.
Okay. All right, so I can no longer see y'all. So if anyone, maybe Olivia, if you can still see people's faces. If anybody looks, upset, let me know. Or has questions, just call it out. All right, so I am gonna start us off. Again, my name is Molly Shriver-Blake. My pronouns are she, her. I'm with Pathways as the Outreach and Community Services Director. And we're gonna go through all of our programs today just very briefly, but we're going to highlight the ones, like how folks can have access to different ones. And what are more available to folks in Franklin County, what's a little bit less available to folks. So the Pathways mission is to end homelessness in Vermont and provide innovative mental health alternatives. Our three focus areas are providing choice, connection, and home. Our deepest belief is that housing ends homelessness, that homelessness is a housing problem. I'll get into this a little bit later, but Housing First is the largest of our projects in which we support individuals with permanent housing. All right, so these are our three main housing projects: Housing First, Rapid Rehousing, and Homeless Outreach and Navigation Stabilization. All right, so Housing First, as you know, I think, what is it, the early 90s, Sam Sambaris out in California started the idea of Housing First, which shifted from that stepwise model of having people go into transitional housing and essentially like show that they are kind of earning the right to have housing, although maybe retrospectively that's what it looked like. I think at that point it was thinking that people were learning the tools to be able to maintain housing before they had housing. Sam had this idea that like, actually, maybe it's easier to reduce substance use, improve mental health when you do know where you're going to sleep at night, and that it feels very secure, and that maybe you don't have to share a room with all these other people. So that was the origination of the Housing First as a model. It moved to New York City, and then Vermont was the first rural implementation of that through the Pathways model with Hillary, who was our director, who we love. So permanent supportive housing, our model of Housing First is an ACT team model using permanent supportive housing for individuals with chronic histories of homelessness who struggle with mental health crises. Those are the counties in which we serve for permanent supportive housing. People do this sort of differently. We do focus on scatter site. So, and that, I think that is part of the original evidence-based model of permanent supportive housing first is scatter site. So not having like one building filled with folks coming out of homelessness. Services are not connected to the housing provider. Services are separated. And then it provides wraparound services, nursing, peer support, psychiatry. We have a rep payee. And then we have another project. So all of our Housing First folks are coming through coordinated entry. And then they get hooked up with vouchers. They could either come with a voucher, or they're going to get hooked up with a DMH voucher, Shelter Plus Care. Now we have another sort of similar, it's not exactly the Housing First model, but we love it. It's our Department of Corrections program. We serve them with the same ACT teams. We have one up in Franklin County, and people are eligible if they have at least a year, but preferably 2 years of being under probation, parole, supervised. They're referred through their probation team, and we hook them up with essentially transitional housing, but we're providing all of these supports and then helping them be independent after that. And so that is something you don't have to wait for coordinated entry to hook people up with. People can be referred from incarceration. So but one of the things that was eye-opening to me is how many folks remain incarcerated because they can't be discharged into homelessness. This is one of those projects that can help folks get discharged because they can get hooked up with housing. All right, Olivia.
Yeah.
Oh wait,
So
actually, sorry. I'm gonna take this back. I don't know if y'all can see the bottom comparative daily costs. The bottom right is the daily cost of a Housing First project, which is $53. I think at this point that includes both voucher and services. Motel stay, this was before the before the cap at 80. But the average motel stay was 132, correctional facility for a night was 260, emergency room and psychiatric hospital. So that's sort of the proof of the pudding if somebody needs to look at things financially, outside of just stability. Cool. All right, for real this time, Olivia.
Okay, so for our homeless outreach and supportive services programs, we have ERAP and PROPS. I'm a member of PROPS. We are a statewide 5-year SAMHSA grant, and we started in October 2023. It's supposed to be for the most vulnerable populations of Vermont. So it's people that fit under the category of HUD's literal homelessness, and also have a serious mental illness diagnosis. I'm working in Chittenden, Addison, and Franklin County. So I know a couple of you already. I have one client up in Franklin. And then we have also a mental health therapist for anyone that wants to participate with that. For ERAP, that's Emergency Rental Assistance Program, and that started in summer 2022. They provide housing navigation, retention services, basically helping with landlords, leases, rental assistance, stuff like that. But both of them focus on housing goals, resource coordination, accessing healthcare, a big focus on peer support, but ERAP is only in Chittenden, Windham, and Bennington counties. So I don't know if that would really apply for you guys. Yeah, I guess we can move on to the next slide. So what we really focus on is intentional peer support. That's one of the biggest trainings that all of us go through, and harm reduction as well. So building authentic interpersonal relationships. We think that that's one of the most important things in order to prevent crisis and to improve stability. Yeah. And moving on from these, like with Connection, we have 2 other programs called the Vermont Support Line and the Pathways Vermont Community Center. Support Line is phone-based support every day of the year, 24 hours a day. There's always someone to call. And the community center is in Burlington's Old North End. Yeah, and the Vermont Support Line. So we've completed over 100,000, I'm sure that's changing every day, calls since 2013. We've diverted over 3,536 calls from emergency services. This is as of December. We were established in 2013. It's a statewide service. It focuses on compassionate peer approach services, and it fills a previously unmet need in the system of care. Anyone could call. We try to focus on a peer approach to supportive conversation. So it's like an alternative to crisis lines and hotlines where it's sort of like, okay, how can we fix this problem? It's not really a problem solving approach. It's more just being there with someone. Suicidal ideation is okay. We can lean into that. We can talk about that, and it doesn't really call for a crisis necessarily.
Olivia, we had a question in the chat from Amanda Reed on the previous slide asking if there's a referral process or should clients self-refer? I think this might be connected to the housing piece of it.
Oh yeah, we have a referral number at the bottom. I can put it in the chat. But also clients can self-refer.
Yeah, there's a number.
Okay, so providers and clients can self-refer.
Yeah, can whoever asked the question, can you, which program were you? Everything is a little different, right? Which program were you?
Well, technically, I think it would be everything coming from a PCP office, you know, it could be a little bit of everything. And sometimes maybe it's like the mental health piece, which is contributing to the houselessness and getting that maybe supported within help.
Yeah, so for props, it would be, which would be a working with Olivia, would be calling that referral number, and that could be you know, self-referral from the individual. Could be setting up a meeting between the 3 of you.
Okay.
But can we also just clarify, because I actually get like a lot of calls about this, that for many of the Pathways programs, people can't self-refer and nor can other providers refer. It has to come through coordinated entry or probation and parole. I do get dozens of calls a year with people saying, I want to be connected to Pathways, and I have to then explain the process of coordinated entry and that we send referrals when there's space available in the program. So could you clarify that a little bit for this group? Selfishly
Yes.
saving myself
No,
work.
I appreciate it. I appreciate it. So our housing first programs. So these are the ones that essentially come with vouchers or subsidies. Anything that comes with vouchers or subsidies is going to inherently have to come from coordinated entry. There is a possibility if somebody already has a voucher that we could start working with somebody, but anybody who is in need of that subsidy, it has to come through coordinated entry. Olivia is different. The outreach project is different. Olivia could come up and work with somebody to try to get onto mainstream subsidy wait lists, but those are very, very, very long. This Housing First ACT team model, what most people in the community are thinking of when they're like, oh, I want to get into that project with Pathways, that's the thing that needs to come off coordinated entry.
And it comes off of coordinated entry if and when resources are available. So sometimes there's a capacity, with vouchers not being available or service providers having very full caseloads. And so it's not something that I can prompt necessarily. It's something we respond to when we're notified of available resources.
Can I ask a
Melissa.
question? And I know the answer to this, but I just want to make sure for anybody who's newer and learning about housing, either Jess or Molly, what is coordinated entry?
Jess gets that one.
Okay. Coordinated entry is a process. It's not a program. It's a process through which people experiencing homelessness or at risk of homelessness are assessed to identify their strengths as well as their needs. And the assessment of their needs includes, it's a pretty hefty assessment, but the reason for that is we're assessing their needs as they pertain to being able to access resources. So for example, we would ask them about chronic mental health conditions, and then that would allow us to flag that they could be a good connection to Olivia. And so through the coordinated entry process, we connect people to resources, including services, case management services, like when Pathways reaches out to say, we have an opening in our family supportive housing program, or we have an opening in our permanent supportive housing program. And many other resources, including housing vouchers and other services, and also including certain types of housing, for example, housing that might have a homelessness preference. So some of our housing providers hold units that, because of the funding that they used to create or renovate that housing, requires them to offer it with a homelessness preference, which also then comes from them prompting a referral from coordinated entry. And I am very sorry, but I have to drive to a 10 o'clock meeting. So it was wonderful to see you. I so appreciate Pathways. They do amazing work and they're wonderful community partners with us.
Thank you so much, Jess.
I will just add that the lists that people end up on coordinated entry tend to be very long, sometimes dishearteningly long, but it is a really important first step to get on those lists. And so that would be, getting in touch with the lead agency and getting those assessments completed. And I think Good Sam can do them as well. Y'all can correct me if I'm wrong. I believe they're assessment partners up there. All right. I think we are back here. Olivia,
I
are
think
you?
we're on the community center one.
Great, thank you.
Yeah. The community center was established in 2012, and they have drop-in hours from 10 a.m. to 1 p.m. Monday through Friday. It's honestly a really amazing place. I love it there. I meet with a lot of my clients there because you can reserve rooms. Again, this may not really apply for you guys, but we have a couple programs that are hybrid. Like we have laughter yoga, and I think the writing group could be hybrid. Yeah. But it's great. There's Wi-Fi, there's a computer, a printer, tea and coffee. They're usually serving some kind of meal, or people can cook their own food. There's a monthly movie night, monthly community meal, anxiety relief group, hearing voices support group. There's employment services. It's a really great place. I love it there. I've met a couple of my clients there. Highly recommend.
Thanks. Right, I'll just highlight the laughter yoga is totally awkward. I've done it once. It was so awkward. But there are a few people who come every week and absolutely love it. There's one family with a young kid who has some sensory processing stuff and just like struggles in lots of ways. The whole family does it together as a way to really once a week as a group, and laugh and enjoy. It's a kind of special thing, worth checking out. This is an example of our calendar of events. Right. Choice is, I don't think we went over all of Pathways values, but choice is like the main one. We want to provide choice, putting people in the driver's seat as a way to enhance ownership over everything. So grounded in the person-centered services, and we'll be speaking about Soteria. Soteria is I think it's a licensed as residential treatment. It's a 5-bed residential treatment. Right now it's in the Old North End. We are in the process of securing a building more downtown, purchasing a building, which is very exciting, and that will expand it to 8 beds. Soteria is a model that started in 1970s that spread around the world, very much aligned with some of the like European ways of supporting folks with emotional differences. Specifically, it is designed to work with people who are experiencing extreme states for the first time in their lives. So typically, it will be somebody with psychosis for the first time in their lives, maybe somebody diagnosed with bipolar disorder. And we do have a psychiatrist, but also part of this model is to not push medication. There's been a lot of studies that if folks can get through this first episode without utilizing medication, their lives can actually, they could seek a different a higher quality of life moving forward, that the medication just sort of alters folks' brains forever. So it is very much a home-like environment, lots of support, but not too structured. We've got 6 months of transitional post-residential support. I think the average, does it say it here? No, I think average length of stay is about a year, maybe 9 months. But I think people have stayed up to 2 years. Most folks are young adults. That's just kind of like the age of onset typically, but we also have served folks who are older than that. This can be a self-referral. We often get referrals from hospitals too. So, anyone in the room can encourage somebody to call just the Pathways main number for this, to explore this. Yeah. Currently, I believe there are 3 in the world. But I also know that there's a few that are trying to start up at this point. And then FACT, I will go over FACT pretty quickly because it is just in Burlington, but it's cool. So FACT is a forensic assertive community treatment. It is evidence-based practice. They are rolling it out in lots of bigger cities throughout the country. SAMHSA recognized. It is a pilot for us. We've had it now for 3 years though. It was a 2-year pilot. They've extended it for another 3, where we are essentially in partnership with probation and parole, working with the folks who they have identified as the hardest for them to work with due to a mental health condition. And we're just providing our traditional ACT, permanent supportive housing sort of services, with the main goals of maintaining housing, but also reducing recidivism, because, you know, it's not really what PNP is totally trained to work with. But they also have assigned a specific team in PNP to work with and grow with this population. So there's an opportunity also for us to like try to really imbue some of these, you know, relationship first practices and peer support, and, you know, how to work with somebody with mental health challenges instead of just focusing on accountability. So it would be great for Vermont to see that grow, because I think it's been wonderful. It hasn't, you know, hasn't kept everybody out, but we're working with the folks who have been in and out of incarceration a lot. It's kind of cool. We're seeing some folks graduate who, cool and scary, who have been under supervision since they're 18, either incarcerated or out for 30, 40 years. Yeah. All right, I'm gonna stop sharing. See if anyone has any questions.
This is Beth from Vermont 211. I'm curious about the outreach program. Does that lead to housing, or is it more peer support?
The end goal is always housing,
Right.
but we don't have any magical mechanism to get folks housing. We will support people doing all the applications and anything they can do to reduce barriers to housing, but we don't have a preference towards vouchers or specific housing opportunities.
Okay, so it's more peer support and assistance with applying for housing?
Yeah, it's housing navigation.
Okay, thanks.
Our support line, we have refrigerator magnets, and we have other sort of materials for that. If anybody would like us to mail some of those things to have either in your offices or hand out to people, I will put my email in the chat.
You know, Molly, another thing you can do as well, if you want to send a small supply of all those materials to me here at NCSS, I can make them available at this meeting next month.
Yeah, that'd be great.
And typically, there's more people in person than there are today, so that's just another way we can get some of this information out.
Yeah, that would be great. I like to tell certain providers that, you know, if you have that one person who just always calls on call, or like, you know those folks who just keep calling you and don't really need to because it's not a crisis. And really what they need is more connection after hours. That is one person to give this magnet to.
Yeah. Good point.
Susan, I'm not sure I understand.
So right now I'm not in an office just yet, and I'm totally remote, so I only see patients over Zoom, so it's very difficult to hand out information and materials. So what I tend to do is keep like little notes in my phone, and then I can copy and paste and send to someone instantly if they're having if they have any needs around it. So like, hey, this is how you connect to resources. This is a number, this is an address, this is an email that you can message someone. So, and I try to make sure I have as many resources as I can, and I'm sure I'm missing a lot of stuff, but things like this just make me think, oh, okay, how can I be sort of that middle person where I can just kind of get that information easily to them?
Yes. Yes. Susan, can you put your email in here too?
Sure.
Oh, thank you, Deb.
Thanks, everybody.
Thank you for a great
Yeah.
presentation. We appreciate you guys.
Yeah, thank you very much, Molly and Olivia. We really appreciate it, and continued success. And unless anybody has any final questions, last call, just in case. Okay, well, thank you very much for the presentation. Okay, so I don't know if anybody has any new initiatives, upcoming events, things that they'd like to share with the group that are coming up in the near future. Megan, I see you have your hand up.
Yeah, so I just put the links. Today is the day that Common Good Vermont's nonprofit wage and benefit survey opens up. This is a really important tool for our nonprofit community to get this information. So you all have access to it. If you participate, you get a free copy. So it's worth it there. This helps us advocate for our sector. So it's very important. If you're a small organization, they assure me that it only takes 15 minutes. If you're a large organization, please pass it along to your HR department and they will get it done. And so I can't emphasize enough how important this is that we all participate. Thank you.
Yep, thanks, Megan. Crystal.
I just wanted to share that we are having a youth event on Sunday evening, the 7th. It's called Solar Soiree, A Night Under the Stars. And we're really excited about this event. A lot of local communities are creating events to celebrate the eclipse, and they are very focused around alcohol consumption as part of that celebration. So our event is a safe and substance-free event for youth ages 13 to 20. And it'll be held at the St. Albans Museum in the Bliss Room from 7 to 10 p.m. We have a DJ and we have food and we have a lot of games and festivities planned for young people. So there is a cost of $20. That proceeds from that event will go towards future youth programs for Vermont Teen Institute and Swanton Rec teen programs. But if you have young people that would like to attend the event and the cost is an issue, please, please, please reach out to me. We have some folks that have donated tickets, and I will never turn away a teenager that wants to come to an event. So please, by all means, share, and I will send Melinda the flyer as well.
Thank you for what you do, Crystal. I just love that.
Thank you. I'm really lucky that we have amazing community partners that are always happy to step up and when I have these crazy ideas.
It's blessed, not luck.
Michelle, did you have something you want?
April is Sexual Violence Awareness Month, so I'm collaborating with Voices for their clothesline project. So we will be doing t-shirts here at the office in Swanton. If anybody knows anybody that wants to do a t-shirt, I will actually get everything all set and send it to you, Joe, and you can put it out to everybody.
Okay, thank you. Yeah, that is a reminder that anyone that wants information included in the weekly updates, if you look at the, well, I guess it does have my name at the bottom here. So that's yeah, send it to me. Or to, we do have a email address that I have failed to put on the agenda, but that's okay. Send it to me and we will make sure that it gets in. And I think that's important because, you know, every week when Melinda sends it, typically on Fridays, it's just a nice reminder before the weekends of all the events and activities that are coming up, either that weekend or in the near future, so.
And I think I'll just do another plug. So the In Their Shoes event is Saturday, May 18th. We'll be meeting at the Samaritan House. It begins at, oh gosh, I should know this. I think it begins at 1 o'clock, so we'll want to get there at noon. The flyer is in the weekly updates. I've been including it, and I'll continue to include that moving forward. And then also, the third annual Substance Use Addiction Summit is on Friday, July 19th. Registration is open, so no charge free booths for your organizations, no matter how big or small the organizations are. We have some that ask for 2 booth areas. We have some that share their booth area with another small organization. So it's no charge, just register so we can get you whatever needs you might have with tables, if you need access to electricity. There's no registration required for attendance. So this is open to the public, and Brad and I have had a dream of getting more members of the public to show up each year. We work closely with WCAX, and we're going to be doing some additional outreach that'll be a little bit more than last year. Also encourage people to become familiar with the WCAX opioid recovery services in Vermont series. I know I butchered the name of it, but if you Google WCAX investigates opioid addiction and recovery in Vermont, you'll see Laura Allman's 3-part series highlighting substance use in Vermont, and this all stemmed from her meeting all of us and all of you at the summit, and she's continued to do more coverage on substance use. Dr. Suzanne White was interviewed, and her story just came out last week on CM, contingency management for stimulant use disorder. We're also going to be having a workshop by Dana Bourne on contingency management for tobacco and nicotine cessation. So just a lot of great topics and areas are covered with this event. Last year we had 91 registered booths. Our goal is to have 100 organizations, and these are organizations mostly from Vermont, but also New York, Maine, New Hampshire. So just want to throw in the plug for that. If you haven't seen the communication on it yet, definitely reach out to me. And also, if you're using my Howard Center email address, that's why you're not getting responses. So make sure you contact my Turning Point email address. And I also will be including this in the weekly updates.
Any other updates or events or?
On the 3rd of May, Hunger Free Vermont and the Vermont Food Bank sponsor a hunger action conference. It's down at the Killington Resort. If you go on the Vermont Food Bank website, I think there's information, and I'll send you some note to put in the update. Okay. So it's a one day event with guest speakers, and then in the afternoon they have breakout sessions. And for those of you who maybe who may have missed it, the showing of the Just Getting By documentary by Bess O'Brien was done here in St. Albans. It was very well attended. If you're out around the state, she's still showing for the next, I think, about week and a half. There are further showings in other places around the state. If you get to go see one, it was an extremely well done documentary, and it really really highlighted, you know, the issue of homelessness and made how these people real. A lot of it was, they had a lot of footage done right here in St. Albans at, you know, down at Martha's Kitchen, interviewing people. Very well done documentary. And it was very, very well attended here in St. Albans, for sure.
And anyone else familiar with Bess O'Brien's work, she was the producer, Kingdom County Productions, for the Hungry Heart film that had come out years ago. And of course, we have our very own Katie Doyle, who now, I know her camera's not showing, but when she introduced herself, Katie did a phenomenal job being part of that film too. So additional plug for that. And the Just Getting By tour dates are in the weekly updates too. So those have continued to be shared on Fridays.
I don't have, well, two things quickly is NCSS will be having, it's really a cause-related event on May the 19th at Collins Pearly, which is our 9th annual Autism Walk. So people can get information either from our website, from me, what have you. Anyway, that'll be May 19th there in the afternoon. And I don't have specific dates, but last Wednesday night, our medical director, Dr. Harris Strokoff, made a presentation at Fairfield Elementary School, and we're going to now take that to other Maple Run schools like BFA, I think City School and the Town Educational School. It's about, I'll hack the title because it's extremely long, but I'll give you the premise. Internet, social media, cell phones, screen time, et cetera, and its effects on anxiety, depression, suicidal thinking of young individuals, our kids and youth. And it was a riveting, he did a great job with the presentation, and also it was really some good lively discussion afterwards. We all know, all of you who have children, young children, and they're begging to get on phones and all this other stuff. The one thing I always like to say from a mental health perspective is just think in terms of when you were 9 years old. For some of us, that's a little harder to remember. But 9 years old, and then in the palm of your hand, what you have access to, unless you've been blocked by your parents, and what level has your brain developed. It is no wonder kids get overwhelmed. Bullying takes place, you name the topic. They are terrific devices. Technology serves a lot of good, but unfortunately, young people are exposed to so much. They try to process it, and again, it's one of the reasons we're seeing so many more young people with anxiety and depression. And of course, for those of you that are familiar, each and every year, it seems that somebody who dies by suicide is yet a younger and younger and younger age, and it's so sad. But anyway, when I do have dates and what have you, I will share those with you. But probably it's going to be like 5:30 to 6:30 at these various schools. And I say that because certainly it's a great opportunity for parents to kind of get immersed in the topic and ask some poignant questions and get some good feedback. So
there's a wonderful 3-part documentary series called Screenagers that we're also hoping to bring to the area, and it's right along the same lines, Joe. And it goes through the course of young people getting their first cell phone and then all the things that have come after the fact. So I'm super interested in taking part in that, and hopefully we can follow up with the documentary as well.
yeah, that sounds great, Crystal. I mean, we cannot what am I trying to say? We can't send out enough information about this because it's something that is on a lot of parents' minds. A lot of times they don't know how to negotiate, you know. Back in the day when I was young, if I did something wrong or whatever, it was very easy to say you can't do A, B, or C. Today, how do you do that with a young person? They're going to figure out a way to get a phone, to get something, go to somebody's sleep, or whatever, to do what they want to do and gain access to what they want to gain access to. Much more difficult today than ever before. So any tips and what have you, I think, are of great value. And I forget what the percent is, but the amount of time that they spend in front of a screen on average is astounding. So anyway, I hate to be a Debbie Downer, but I mean, I think that's just important. It's just an important topic that we all just need to be eyes wide open on as it progresses. So anyway, any other?
Yeah, maybe just a further comment. I mean, beyond young people, unfortunately, we all talk about technology, but today we have the technical ability to do things that we haven't figured out morally or socially how to handle. Technology has outraced our ability to be able to effectively manage it and deal with it, you know, on the human level.
Yeah.
It really has. Children are probably the most vulnerable, but
Yeah.
we're all in that situation.
No, you're right. Yeah, yeah. Everyone is. But the thing that, you know, we are concerned with, I know we all are, but here at NCSS is the young age at which young people get involved in technology. And let's face it, in the schools, many of the schools, you have to, everything you do is on a,
they all have a laptop. They all
laptop,
they all
yeah,
have a
yeah.
tablet.
So a tablet, laptop, whatever, and that's the way that they're being taught, and that's understandable. But that also leads to some of these other dynamics. And anyway, so it's just trying to find balance, that's all.
The state of Vermont is writing their suicide prevention strategy right now. So hopefully a lot more to come as far as support from the state.
Yeah, and you know, Devin, we're always, for a small state, and I know everything's per capita, but we're always in the top 10 as far as from a per capita standpoint when it comes to suicides. And yeah, anything that can be done to curtail that is going to be great. So anyway, anyone else have any events or initiatives you'd like to talk about before we close today? Or
Can I ask a question on that? Which is, I don't know, maybe not the point of this meeting, but so the numbers, we are so high, and the rural areas are by far the highest. And I absolutely am anti cell phones, but we also know that the lack of connectivity in the rural areas is a big contributor as well. In the Franklin Grand-Isle community, you know, the affordable internet program federally just went away. How are folks doing with being able to access internet in the county?
now, what are you hearing? Because we know there's areas that's extremely difficult.
Yeah, I know they were just on the news the other day. The state, they've got that money from the feds to improve internet access, and they're really working hard trying to map the state to figure out, okay, where are the pockets that are really seriously underserved. I'm kind of right on the edge. I have really good internet access, but I'm like right on the edge of Sheldon. I'm kind of right on the edge of really good. I have good internet access, but I'm kind of right on the edge.
Yeah, you
for
still
myself.
They pay for it. So one of the things we find when folks are moving out of the hotels into housing is they actually have to give up access to internet because they can't afford it.
They can't afford it at their house. Yeah.
Molly, I appreciate you saying that too, because we've found with the population I work with, individuals that I see at the emergency department that are presenting for any medical issue that could be substance use related, a number of the people that I see are people struggling with homelessness, living in encampments without phones at all. We used to get through CORA, Center on Rural Addiction, they were providing phones, and they were just such an amazing resource and partner, and also that grant no longer provides phones. So we're finding the challenge of, you know, even if somebody could access Wi-Fi, internet, getting the device, right? There's still safe links, there's still queue links, and also in order for somebody to receive those phones and get things shipped, where do you ship it to? So that's another barrier that we're finding again with the population that I work with the most vulnerable, struggling with substance use and homelessness and lack of communication. So I appreciate that you said that openly, because I have that fear that we'll lose sight of and just assume that people have phones, so we can do telehealth, we can have recovery coaches call to check in, we can have, for me, the most critical phone call for those individuals to receive are the calls coming from the residential treatment locations that we do the initial screening from the emergency department, and they need to get that follow-up call to say, you've been accepted, here's your bed date, make sure you present at this date, and there's no way to get that information to them. So I just appreciate the awareness on communication being a huge barrier to connection, treatment, recovery, healthcare.
And even if you're on the phone where you charge it,
Yep.
it feels, I know that we all know this, but so much federal money has gone away, and I just worry so much about the cracks that are getting bigger and bigger.
Yeah.
I love your heart, and I totally understand what you're saying and appreciate your perspective, because it's something I would not want to see us lose sight of.
Yeah, and thanks for bringing that up, Molly, because, you know, my whole blah, blah, blah here was focused on those that do have the devices, but you're so right, there's so many who don't, and that creates its own set of challenges and problems as well, so.
Yeah. Food security fits right in there too, with all the, you know, the programs of providing extra money for WIC and extra money for Three Squares going away is putting a lot of pressure on, a lot of food pressure on families. We're seeing it at food shelves for sure. Jess would echo that if she were still on.
Yeah. Anyone else? Anything
I
else?
think on a happy note, we're gonna have 4 days in a row with sunshine in the 50s next week.
Next week, just gotta survive the next couple of days.
Yeah, and then of course Monday, everybody just kind of take a deep breath, and you know, there may be log jam in Vermont. Yeah, depending who you talk to and how many people are gonna come to our area, who knows? But there will be a lot, there will be an influx, and it will be a lot different than a regular day in Vermont, that's for sure. So just know that it's going to be a little tougher getting around, and hopefully the weather's going to be cooperating. I know as of yesterday it was going to be
55 and sunny.
So it'll be an amazing few hours here in this area. And elsewhere as well, but certainly in this area. So anyway, everybody stay safe, and keep doing the great work that you're doing. And I think we have some found time for everybody, maybe 12 minutes or so here. But again, I'd like to I'd like to thank everybody for being here today. We will reconvene on May the 1st, 8:30 to 10:30, just like today, in person and hybrid. And, you know, hopefully you'll be able to spend some time with us again next month. So once again, thanks everybody for taking time out of your schedules today. And thanks once again to Molly and Olivia for a nice and for all the work that you do. And all of you for all the work that you do for the residents of this area. And keep up doing the great work, and we'll see you next month. Thanks again, everybody.